Living through a pandemic, how the Lowcountry moves forward.
From Washington to the South Carolina State House to right here in the Lowcountry, the war against COVID-19 wages on.
Now political, medical, and education leaders say we are continuing to fight this virus.
I am optimistic that by the end of the year we will have a vaccine.
The world of sports, even weather, rocked by the pandemic, still finding their way.
And people in our area are finding hope, even during these difficult days. Tonight, News 2 presents Living Through a Pandemic, how the Lowcountry moves forward. Good evening, and thank you for joining us for this special edition of News 2. I'm Carolyn Murray.
It's good to have you here. I'm Brendan Clark. For months now, we've been bringing you the daily case totals and death counts in the COVID-19 pandemic on a national, state, and local level. And while those facts are very important, tonight's show is really about perspective of what this pandemic has meant and will mean moving forward for the Lowcountry as a whole.
And tonight we have team coverage from the entire News 2 team. Anchors Brad Franco and Sophia Desasor speaking with some of the top medical and education minds in the state and in our community. And here in the studio tonight, the Lowcountry's Chief Meteorologist Rob Fowler and Sports Director John Barron will describe the impact of the pandemic on people, how they function, as well as how they enjoy life.
We also have the Charleston Mayor, John Tecklenburg, live in our studio, socially distanced, of course, to tell us how the Lowcountry is moving forward through COVID-19.
We have a lot to get to, so let's start with the latest facts on the pandemic from one of the Medical University of South Carolina's top epidemiologists, Dr. Robert Ball. Brad Franco reports.
Our concern is a lot of young people going to bars and restaurants without wearing masks and crowding together and being in each other's faces, shouting over the background noise and spewing virus.
And the young people, you're saying that they're the ones driving it?
Primarily, but not only.
What else? What's the other big driving factor then, besides that?
Not so young people doing similarly, and then people who are indoors who don't wear masks and infect others. There's something about this virus that scares me. I've never been scared of any virus or pathogen until this one. I diagnosed South Carolina's first case of AIDS, didn't scare me a bit. And since then, Zika and other exotic diseases, no fear. This one scares the bejeebers out of me.
Why?
Because it's, on the biology of the virus, highly transmissible. More so than we ever thought before. We know that it's transmissible by large respiratory droplets, hence the mask wearing is so critically important. But it may also be transmissible airborne. That is, if you cough or shout or sing in a choir, that's been well documented, then you are spewing virus way beyond your 6 feet. And in fact, there are some studies that show that micro droplets, microscopic droplets, can go 15 to 20 feet in a closed room, average size closed room, that has poor ventilation. Hence, the ventilation is more important, something the schools are going to have to seriously work on.
Well, you brought up the schools because that is top of mind right now. So can we send our kids to school? Should we?
Sending kids to school is a very complex issue that the educators and government leaders are going to have to address more in detail, including social distancing, the mandatory wearing of masks, even indoors, especially indoors, hand washing, and ventilation. They may have to improve the ventilation systems with high efficiency filters that will trap most particles.
Would you send your kids?
Thank goodness my kids have grown and gone, but I worry about my grandchildren. And yes, I would probably send them as long as all of those restrictions were in place. And their parents feel identically. My son has asked me numerous times, should we send them? And the answer is it's complex.
Yeah. It's not a simple yes or no.
Correct.
How encouraged are you by the newest vaccine information that came out yesterday?
I am optimistic that by the end of the year we will have a vaccine that can be put into late phase 3 trials on thousands of people, and let's see what kind of immunity develops.
And we are also talking to local leaders about how they are handling this pandemic, the measures taken so far, what they are thinking about for the future in this new normal. We're speaking with City of Charleston Mayor John Tecklenburg now about the issues facing the city and really the Low Country as a whole. Mayor Tecklenburg, gracious enough to join us right now. We certainly appreciate this. And Mayor, I talked to you a little over a month ago, and we really thought we were on the backside of this thing right now, but now we're not. In zip codes that make up downtown Charleston, more than 3% of residents have tested positive for COVID-19. May not seem like a big number, 3%, but it really is.
That's a big number.
How difficult is it for you to see that we are a hot spot when it comes to COVID-19?
Well, it's very disappointing and sad. You're right. A couple of months ago, even 6 weeks ago, we thought we were in a pretty good spot.
Sure.
But when we reopened up, we talked about a new normal, but we really just went back to doing business as normal and going out, and as Dr. Ball said, folks going to bars and restaurants and beaches and gathering and without masks on, and that's not the new normal. So I'm very pleased to hear him say that he's confident we'll have a vaccine by the end of the year, and I know they're testing one already. So until there's a vaccine in place, all our citizens, everyone, we really need to follow these measures. I try to make it simple. I call it the 3 W's. W for wear a mask, W for watch your distance, and W for wash your hands.
We've seen you walk around downtown King Street trying to raise awareness. You were handing out masks to people.
That's right.
But we've also been downtown. We see long lines at bars and restaurants. We see people not doing what we hope they should be doing. How is this going to end when people just aren't respecting these guidelines?
Well, at City Council this week, we did pass a more strict ordinance about wearing masks. They're required everywhere now in the city of Charleston. We have increased penalties, and we've been educating folks up to now, but we're going to start having to write some tickets because we need to change some behavior, folks, and get to this new normal. Otherwise, we're going to tax the healthcare system. They'll be overwhelmed. We won't be going, our kids won't be going back to school. You know, Charleston School District, they were originally planning for mid-August, and now they're into September. If the numbers keep up, we won't even get our kids back to school on time. So it's so important.
You talked about the hospital systems. Of course, we have the Medical University of South Carolina, MUSC, have Roper downtown, some major health systems downtown. Have you talked to them? What are they saying they need from you? Anything?
So their numbers have doubled in the last couple of weeks, Roper's particularly, and they're getting to the point, they're at a challenge level. They're not quite overwhelmed, but if these numbers continue for a few more weeks, they will be. So there will be pressure on supplies, but more importantly on medical personnel. And God bless our medical care professionals, nurses, doctors, everyone that's working in the healthcare profession that's attending to this. They are really heroes, and I'm so thankful for them. So they're going to be needing extra nurses to the extent we've been able to connect them with CDC and DHEC. They had some of those connections, of course, already, but we're trying to get supplies to them as these numbers continue to increase.
So many businesses and business owners in downtown Charleston. What are those business owners saying to you about this? I mean, there's definitely just a double-edged sword here. They need to make the money, but they need to be safe, half capacity. There's so many different things to think about when it comes to this.
Right. So it's just been a double whammy on businesses having to shut down earlier this year and then reopening, and the numbers aren't there yet for them, and now the numbers of COVID cases are rising. So the last thing we want to do is close businesses again. I think everybody agrees on that. But we may be forced to if these numbers continue to rise, and that's why I sound like a broken record. But if people, when they go out in public and they're close to other folks, you really need to be wearing a mask.
All right. Charleston Mayor John Tecklenburg, thank you very much for joining us. We'll hear from the mayor coming up a little later in the show. Carol Murray will talk to him about other subjects important to us here in Charleston and the Low Country. Meanwhile, we are talking about Housing and Urban Development Secretary Dr. Ben Carson prepared for a forum on expanding access to capital in minority and underserved communities in the Low Country. Dr. Carson spoke about the housing burdens many are facing due to the pandemic from Washington, D.C. With people laid off or furloughed, many are finding themselves unable to pay rent or utilities and even facing eviction. He says those evictions can be prevented if renters, public housing authorities, and landlords utilize his department's resources.
For the PHAs and the landlords in terms of forbearance, for the renters to recognize that there are things available like rent recertification. If your rent is based on your income and your income drops dramatically or your job has that vapor, you can be certified so that the government then is able to pick up that portion. But if you don't know about it, obviously it's not going to happen.
And we have more information about eviction moratoriums, resources for you online. Our website is counton2.com.
Next on News 2.
Well, 2020 hasn't pulled any punches with an expected active hurricane season peaking soon. Storm Team 2 has a look at how to manage both weather and COVID-related anxiety.
And later on, we'll be talking more about how the virus has impacted the sports world. All those details from your News 2 sports team.